In today's Eye on Health, a look at another way social distancing is really changing our lives. Virtual visits, not with just your family and friends, but maybe with your doctor. We're talking with family physician Dr. Amy Crawford-Faucher, Vice Chair of AHN's Department of Family Medicine. And specifically, we're talking about how these calls are helping in these times of COVID-19. Thank you so much for being with us, Doctor. We appreciate it.
Good morning. Thanks for having me.
And you know, the timing on this is really spot on because so many people may have concerns about COVID-19. They don't really want to go out and meet a doctor in person, but this virtual visit is a way you can get your questions answered, right?
That's exactly right. You know, we want to participate in social distancing and staying at home as much as everybody else, and hence you can see my living room in the background. But people have questions and they want to connect with their doc, and this is a wonderful way to do that.
And what should you do right now if you think maybe, hey, I have some of the symptoms they're mentioning on TV. What if I do have COVID-19? What advice would you give to people right now?
Stay home.
Mm-hmm.
Stay home, and not just stay home, but quarantine yourself away from other family members or people in your household. That's staying in one room, hopefully using one bathroom, not touching things other people are touching. It's really even taking that social isolation and self-distancing to a further level. And then talking to your doc, you know, virtually is the best way to do that.
And when should you call your doctor? I mean, at what point should you make a virtual visit?
You know, I think anytime you have a question, because there's a lot of worry out there. We feel it as healthcare providers, and patients certainly feel it as well. I would much rather have someone set up a virtual visit to have that conversation than worry and then not really know. Now, we're not able to test everyone who is concerned about it, but we can certainly make that connection, reassure, and give medical advice on what to watch for and when to call us back.
And the video component of this is really important because you can get more information when you have the video than just talking to someone on the phone, right?
Sometimes, yeah, that's exactly right. And you know, we're learning this a lot more quickly than we thought we would need to as well. So yeah, you can get a lot from looking at someone and saying, you know, is your breathing a little bit heavy? Are you having a hard time finishing your sentences? Do you just look sick? And that's part of the medical training we get in medical school in our training anyway. But you know, we're used to doing that when I'm actually in front of a person as opposed to doing it through a video screen. So we're all learning quickly as we go along.
You know, and we're talking about this in reference to COVID-19, but virtual visits are something new that's been going on already. Tell us what you're seeing, why patients are contacting you and deciding to do it virtually as a general rule.
You know, I would say the last 2 weeks that almost all of the calls are related to upper respiratory infection symptoms and concern about COVID. And that is the main reason. And we're screening everyone at AHN who calls in or who connects through our MyChart virtual app to see whether they have those questions. Because again, if you have those symptoms, we want to help you, but we would rather have you not get out into the community and come into a doctor's office.
Sure. And how do you determine if someone is high risk or low risk? Like, what sort of things do you look at?
So the highest risk people, and the CDC has just kind of clarified their recommendations on this, the highest risk people are healthcare workers, actually, because we are by definition more likely to be among sick people who may have this, especially as COVID gets more prevalent in our own community. The next highest group are people with underlying medical conditions. So immunocompromised people on medications that might weaken their immune system, some cancers, diabetes, heart disease, those kinds of things. Older folks in general over the age of 65, but particularly those with these underlying medical conditions that I mentioned. Pregnant women are in that higher risk category as well. So low risk is generally younger people, or middle-aged people who do not have chronic medical diseases.
Okay, and if someone does want to have a virtual visit, an AHN patient, how do they line that up? How do they schedule that?
So if you already have MyChart through your Epic, which is our electronic health record, you can actually self-schedule on that. If you do not, then you can call 412 Nurse for You or 412 Doctors, and they can actually get you set up and connect you to getting that app so that you can set up that virtual visit. For patients who already have primary care docs in the network, then you can call your doctor's office and we can set you up for a scheduled video visit with your own or a partner's doc.
All right. Well, thank you so much for having a virtual visit with us today. We appreciate it. We appreciate the good information, and we especially appreciate what you do. Thank you to you and all the other doctors who are doing so much right now.
Well, thank you very much, and I want to extend that to all the nurses and other healthcare workers working in the trenches. So thank you very much.
Absolutely. Thank you. And remember to keep watching for our Eye on Health series here on PTL. Happens on Wednesdays, and it's brought to you by Highmark, Blue Cross, Blue Shield, together with Allegheny Health Network for your health. And we also have links to all the information she was talking about there at pittsburghtodaylive.com.